This, I also would like to thank Dr. John Javas, Professor Madhu Kishwar, and the steering committee who has given me this platform to share some of my thoughts and concerns. Moreover, there is something else I would like to point out. I've been studying religion for about 15 years now, and never I've had a chance to share a dais with saffron-robed people. So I consider it a very special occasion that I have two Swamis in the audience. And I think at this point I have started a dialogue with the practitioners of religion which I've been studying as an anthropologist. Thank you. This paper draws from my doctoral thesis, and my doctoral thesis is a comparative study of Indian self and the Western self. The study has been conducted through life history method, looking at two biographies in two different cultures. For the Western case, I have used Erik Erikson's life stages, and the Indian case, I have applied the 4 ashram method. The fieldwork for the Western case was done in southwest France among the Catholic women, and for the Indian part, I have done fieldwork in Vrindavan in North India. It may be pointed out at the beginning that the 4 stages of life in the Hindu thought is considered essentially Brahmanic and therefore discriminatory. However, this has been my subject of study to look at personality formations and how this can be looked at as a possible model of how the self gets formulated in the Indian context. I must also submit that this study is a possible model of aging and related issues in an urbanized post-industrial society. In the course of life history narrative in 2 continents and 2 cultures, I have looked at how the notions of aging, life, living, and death are different in 2 different communities. For the French life history narrative, I worked in an old age home in Auchan. Auchan is about 20 kilometers away from Toulouse, southwest France. For the Indian part, for my ethnography, I worked in an ashram in Vrindavan. I must also share something which I would like to. My sensory memories of the 2 fieldwork, 2 ethnographic sites are still fresh with 2 different kinds of smell that dominated my fieldwork in an ashram in India and in an old age home in France. Perhaps these 2 smell categories also store 2 different sets of cultural practices and 2 worldviews. Moreover, there is something extremely subjective and cultural about the way my memory has stored my experiences from 2 different ethnographic sites. Auchan reminds me of disinfectant and air freshener. Very good air freshener, I must admit. And Vrindavan memories are replete with the smell of camphor. So, well, I'll now begin. I shall concentrate on the fieldwork in Vrindavan, India. Through the lifestyle of ashram inmates in Vrindavan, this paper addresses the notions of cultural and religious sensitivity in the care of elderly people. It looks at how various aspects of culture and religion contribute actively to emergence of public health concerns and society's commitment and capacity to respond to the significant health needs of the older population. In the text, I've used the term gerontology. It is derived from the Greek word geras, meaning old age, and logos, referring to the study of the subject. The term gerontology is very broad and encompasses the psychological, socioeconomic, and physiological dimensions of aging. Social gerontology is concerned with reciprocal relationship between the individual and society. I thought of spelling out these terms because some of us might not be familiar with the term gerontology. Also, there is a rampant discrimination against individuals on the basis of aging or old age, especially manifest in urban post-industrial societies. When I came back after my doctoral studies to India, one of the images which regularly strike attention in Delhi is the news headlines screaming out of violence against the elderly as a routine affair in Delhi. Well, I started to take it more seriously, and I looked up various reports